After 60 years of age, have you experienced a weakening of your legs? You have to push off your knees to stand up. Lifting weights is comparable to stair climbing. And sometimes, just walking across the living room throws you off balance. Most folks think this is just aging. But here is the truth. Actually, it's among the first signs of sarcopenia or age-related muscle loss. Additionally, it is silent. No pain or edema until you eventually require help getting out of a chair. But here's the good news. It has been shown that just 3 essential vitamins can assist recover leg strength in a few short days. The right nutrients at the right time, without expensive therapy or demanding activity. The 3 vital vitamins that every senior needs are explained in this video, along with how deficiencies result in weak, heavy legs and how to safely and effectively combine them for a speedy recovery. This isn't rumor or health gossip. It is supported by real research, clinical studies, and decades of professional expertise. Follow me all the way to the end. I'll also show you a vitamin regimen that works quite well but isn't followed by most individuals. Your body undergoes a slow but discernible transformation. Your bones begin to break more readily after the age of 60. Your blood flow becomes less rapid. Your muscles, especially the ones in your legs, also start to deteriorate. Most people don't realize that the initial weakness usually occurs in the legs, which makes even basic activities like walking or standing up challenging. According to the American Geriatric Society, people over 60 lose 1 to 3% of their muscle mass a year, even if they are eating normally and feeling good. This suggests that you may lose up to 15% of your leg strength in just 5 years without even realizing it. So why does this happen? There are 3 main reasons. The first reason is vitamin deficiencies. As we age, our stomachs produce less acid and our bowels are less able to absorb nutrients. This leads to low levels of vitamins D, B12 and bone, all of which are essential for muscle contraction and nerve transmission. The second factor is poor circulation. Slower circulation means your legs get less oxygen and minerals. The result? Heavy, tired legs, frequent cramps and early fatigue. Less physical activity is the third factor. Elderly people who walk less or avoid stairs eventually have a weakening and reduction in leg muscles. Furthermore, even with frequent exercise, muscles cannot completely recover. Without the right diet, the good news is that by replenishing these 3 lacking vitamins, you can potentially regain your leg power in a few short days. Let's now take a closer look at each vitamin and see how it works. Let's start with the one that the majority of senior citizens avoid. Vitamin D3 is the switch that reactivates leg strength. There is more to vitamin D3 than meets the eye. Were you aware of that? It works more like a master switch reactivating your complete skeletal, muscular, and neurological system. That's where the problem is. After the age of 60, your body's capacity to produce this vital nutrient drastically decreases. Your skin becomes thinner. As you get less sun exposure, your liver, kidneys, and vitamin D conversion slow down. As a result, your body begins to shut down important processes. Your muscles deteriorate. You have hefty legs. You go slowly. Worst of all, you begin to lose your balance since you're slightly lacking in vitamin D3, which is essential. Why is vitamin D3 so crucial? Vitamin D3 aids in the absorption of calcium, which is necessary for strong, healthy bones. But that's just the beginning. It also ensures proper contraction of your muscle fibers, prevents muscular atrophy, which happens gradually as we age, and above all, makes it easier for your neurons to transmit information. Your body gets weak and unstable like the baggage of an old machine when you don't have enough D3. How can you tell if you don't have enough? Vitamin D3? Leg weakness, especially when climbing stairs, fatigue from standing or walking. Leg cramps at night, trouble turning or stepping quickly, and excruciating pain in your hips, knees, or heels are all warning signs. Additionally, some people may have mild anxiousness, irritability, and trouble sleeping at night. In actuality, these minor symptoms are early markers of vitamin D. The third is insufficiency. However, they can occasionally be mistaken for aging. What is the consensus among scientists? In the UK, researchers from the University of Birmingham examined adults over 65 in just 5 days. Participants' leg strength rose by an average of 19% after eating 800 U of vitamin D. Seniors who took a D3 supplement and did minimal exercise demonstrated significant improvements in their leg power and balance in a matter of weeks, based on a different study from China. Furthermore, older adults with low vitamin D3 levels had a 40% higher risk of falling or needing hospitalization than those with normal D3 levels. According to data from Harvard's Geriatric Data Center, the message is clear. Vitamin D3 protects both your bone structure and your independence. How does it work? When your D3 levels return to normal, your body absorbs calcium more effectively, encourages the growth of new muscle fibers, improves muscle contraction and response time, reduces latent inflammation in muscle tissue, and makes movement easier and painless. In other words, vitamin D3 reactivates your muscles and joints. What dosage is advised for healthy adults over 60, people with a history of falls, or those who clearly show signs of frailty should take 800 to 1.00 international units U a day? According to experts, under medical supervision, take vitamin D3 in the morning or early afternoon for best absorption, and always after a meal that contains healthy fats like salmon, eggs, or olive oil. Since D3 might disrupt sleep, it should never be used right before bed. Do you have enough food? Unfortunately, not without challenges. Let's look at the numbers. A 100-grain meal of fish contains about 500 U. One egg only provides 40 U. A glass of milk that has been fortified contains roughly 100 U. To get 1.0 international units from diet alone, most seniors would not be able to eat fatty fish, eggs, and milk every day. This is why it is often required to take vitamin D3 pills. Who ought to consider taking supplements right away? If you have osteoporosis or joint pain, are over 60, spend little time outside, feel unsteady or have fallen in the past, or follow a plant-based diet low in dairy and fish, vitamin D3 should be your first focus. Some important cautions. Despite D3's generally benign nature, prolonged excessive use might cause problems. In sensitive individuals, prolonged use of more than VU daily may result in irregular heartbeats, kidney stones from high calcium levels, headaches, constipation, or nausea. This is the important component. Use the right amount at the right time, and monitor your levels frequently. Vitamin D3 is essential for helping elderly people regain their leg strength. This switch reactivates your muscle systems that have gradually slowed down. In a few days, if done correctly, you will notice improvements such as lighter steps, stronger legs, and more confidence in all of your movements. Vitamin B12 restores nerve health, balance, and leg confidence. Let's talk about vitamin B12, one of the most crucial yet frequently overlooked supplements for adults over 60. As you may already be aware, vitamin B12 promotes energy and memory. Most people don't know this, though. The communication between your brain and muscles, especially your legs, depends on vitamin B12. It keeps your reflexes fast, your movements coordinated, and your nerves healthy. When your B12 levels drop, the connection between your brain and muscles becomes unclear, and the first symptoms often start in your lower body. What happens if you don't have enough B12? Your feet may burn, tingle, or become numb, among other symptoms. Leg weakness, especially when walking or standing. A sensation that your legs are either drowsy or not paying attention. If your B12 levels are below ideal, you may experience unsteadiness, difficulty balancing even on level ground, or the need for assistance when walking. Some people also experience cognitive fog, forgetfulness, mood changes, and mild depression. Often, these symptoms develop gradually. Many seniors believe they are just getting older. In actuality, though, they are the classic indicators of a B12 deficiency. Why do elderly have a higher prevalence of deficiencies? There are two main reasons. The first is insufficient absorption. As we age, our stomachs produce less acid. especially if we take medications like ranitidine or omeprazole that reduce stomach acid. In this low-acid environment, obtaining B12 from food is more challenging. Dietary restrictions come in second. Dairy products, meat, fish, and eggs are almost the only foods that contain vitamin B12. Eating a diet high in plants or consuming less meat makes you more sensitive. Even with a nutritious diet, your body might not absorb enough. This explains the high prevalence of B12 deficiency in those over 60. What is the consensus among scientists? The effects of low B12 on older adults' mobility have been shown in numerous research. Seniors 65 and older with low B12 levels walked more slowly, had far lower balance, and were more than twice as likely to fall in the future year as those with normal levels, per a study from Oxford University in the United Kingdom. Journal of Gerontology clinical trial in a randomized study. Elderly received 1 to 0 milligrams of vitamin B12 daily for 8 weeks. Participants reported improved lower body strength, quicker reaction times, and reduced numbness and instability after taking supplements. B12 not only helps you think more clearly, but it also maintains your body's equilibrium and control. The way that vitamin B12 works in the body. The development of the protective sheath that envelops your nerves is encouraged by vitamin B12. This facilitates energy metabolism, the generation of red blood cells, improved oxygen delivery to muscle tissues, and rapid, accurate messages from the brain to muscles. As a result, muscles get the energy they need to work. A B12 deficiency causes your nerves to fail, your muscles to misinterpret commands, and your legs to feel disconnected. Who is most likely to be affected by B12 insufficiency? You are more likely to have low B12 if you are older than 60. Use antacids or acid blockers on a regular basis. Follow a vegetarian or low-meat diet. Take metformin and have diabetes. Have gastrointestinal surgery or weight loss surgery. Have gastritis or IBS, or routinely drink alcohol. If this applies to you, it's worth doing a fast blood test to find out your B12 levels. Signs that are often ignored. Some people may not feel the usual numbness or tingling. Instead, they have mild headaches, fatigue that does not go away with rest, clumsiness, or dropping objects, and intermittent pain or buzzing in their feet. These are all indicators that your body is trying to tell you something, and the sooner you take action, the faster you heal. What is the suggested B12 dosage? For people over 60, a daily intake of 500 to 1.0 milligrams of methylcobalamin is safe and effective. Methylcobalamin. Why? Since it is the active form of vitamin B12, your body may use it right away without converting it. Given that conversion rates decline with age, seniors will especially profit from this. It is available as chewables, sprays, sublingual tablets, and dissolves under the tongue among other forms. It is preferable to take it with lunch or in the morning because tea and coffee can hinder absorption. Can you get enough by just eating? In theory, yes. In practice, however, it is unlikely. This is how much B12 is present in normal foods. About 70 milligrams in 3 ounces of beef liver. About 4.5 milligrams in 3 ounces of salmon. Just 0.5 milligrams. 1 giant egg, it's about 1 milliliter or 1 cup of milk. Therefore, you would need to eat a lot of fish, dairy products, or liver each day to meet your demands. For most elders, a supplement is the more sensible option. Is it safe? Water dissolves vitamin B12. This means that your body has cleared away any surplus. Tell me where you're coming from today, please. Please feel free to post a comment below and ask any questions you may have before we start. To ensure you don't miss any of Senior Health's best health tips, don't forget to click the subscribe button and turn on notifications. It is quite safe, even at high dosages. There is no known deadly level of B12 in healthy individuals. However, please see your physician if you have chronic renal issues or are taking blood thinners. Otherwise, for most people, B12 pills are one of the safest and most effective ways to boost energy, improve nerve function, and regain control over one's legs. The real impact of true stories. Many elderly people report feeling more stable when walking, regaining sensation in their feet, standing up more confidently, and even sleeping better once their nerve symptoms go away, all thanks to a vitamin that most of us ignore. In addition to being a brain vitamin, vitamin B12 is a movement vitamin. When those lines are clear, your legs feel stronger, your muscles respond faster, and your confidence returns. It also re-establishes the link between your brain and body. If you have been having strange feelings, limb weakness, or trouble balancing, don't ignore it. Check your B12 levels and give your nerves the vitamin bone they've been craving, the key to preventing weariness and boosting muscle energy. You are undoubtedly aware of how vitamin B12 promotes nerve-to-leg connection and how vitamin D3 aids in muscle growth. Thiamine, another name for vitamin bone, is the final piece missing from the puzzle. The electrical or the energy your muscles need to move is provided by vitamin bone. Without it, your muscles simply cannot function if D3 activates the lights and B12 connects the lines. Even if your bones are strong and your nerves are sharp, your body would run out of fuel without bone. What is vitamin bone, and why is it so important? Energy metabolism depends on vitamin bone, also referred to as thiamine. This suggests that it facilitates the process by which food, especially carbohydrates, is transformed into ATP, or usable energy. ATP powers every breath, every muscle contraction, and every movement. Furthermore, your legs require a consistent supply because they are the largest muscles in your body. When your bone density is low, your muscles feel heavy, tire fast, and recover from any action poorly. Signs of a potential vitamin bone shortage. These early indicators are described by many people over 60. Legs feel weak or very tired. Even when not moving much, muscle cramping, especially in the calves or feet, a heavy, dragging sensation when moving, getting dyspnea when going upstairs. Occasionally, after waking up, I feel fatigued or light-headed. Some folks may also experience mental weariness, lack of appetite, a general lack of motivation to move. These are common signs of a sluggish metabolism in the muscles. Bone often plays an important part. What leads to senior bone deficiency? There are several reasons. The first is a decrease in absorption as we age. Our digestive system's capacity to absorb thiamine from food decreases. The usage of drugs comes in. Second, bone is washed out through urine by diuretics, which are commonly used for heart issues or high blood pressure. Metformin with antibiotics may have an impact on bone levels. 3. Consuming alcohol. Even little amounts of common alcohol, such wine or beer, can impair a senior's capacity to absorb bone. A poor diet comes in fourth. In many processed foods, bone is removed. Additionally, if you're eating less whole grains or legumes, your consumption may be too low. What is the researcher's conclusion? Tokyo University Study 2021. Among the 300 elderly individuals in the study, almost 30% had low bone levels. These individuals also moved more slowly, had more weaker legs, and often complained of muscle fatigue. After taking bone supplements, the majority showed a discernible gain in energy. Walking distance and stair climbing. Research, Journal of Neurological Sciences. Patients who experienced chronic leg weariness were given 100 milligrams of thiamine daily. After 7 days, 82% said their endurance had improved. Less leg discomfort and heaviness were reported by 68%. There were no negative consequences. How are your legs supported by bone? Vitamin bone powers your body's main energy-producing system, the Krebs cycle. This enables your muscle cells to maintain their strength and tone throughout the day, manufacture ATP more quickly, and recover from movements more quickly. Furthermore, bone makes it easier for nerve signals to travel, especially in the peripheral nerves that control your legs and feet. It's similar like trying to drive a car without gas. While you're boneless, everything works, but nothing moves. What quantity of bone is needed? The recommended daily dose is only 1.2 milligrams for men and 1.1 milligrams for women. However, for elderly individuals with symptoms, far higher dosages are often used for therapeutic benefit. Seniors with nerve issues, fatigue, or weakness in their legs are frequently advised by doctors to take 50 to 100 milligrams each day. The good news is that excess bone can be safely removed by urine because it dissolves in water. What is the ideal time and method to take it? To help you have more energy throughout the day, eat bone in the morning. Always take it after a meal, ideally one that has some protein or healthy fat. Avoid taking it with coffee, alcohol, or black tea. These could prevent absorption. Is it possible to get bones by diet? Yes, but you have to be intentional. Bone-rich foods include organ and pig meats, legumes like beans and lentils, sunflower seeds, and whole grains like brown rice or oats. However, most elderly people don't eat enough of these foods every day, and some illnesses or medications make it difficult for them to absorb them. Therefore, if you're not sure or have recently experienced exceptional exhaustion, a supplement might be a better option. Who should consider supplementing with bone? If you have type 2 diabetes, you should get your bone levels examined or just restored with a safe daily dose. Drink a lot of alcohol, take diuretics, metformin, or acid blocking medications, feel tired even after light activity, or have lost weight or appetite for no apparent reason. Is it safe in fact? Vitamin A is considered to be one of the safest supplements for elderly people and is recognized to be safe even at high dosages. However, if you are taking medicine or have liver or renal problems, please see your doctor before starting a high-dose bone. Real results after just 3 or 5 days of taking bone. Many seniors say they feel more energized. The legs feel lighter as a result. Walking becomes effortless. Climbing stairs is less taxing. And the want to move and be active returns on its own. That's like putting fuel into an engine that has been sputtering for years. Finally, vitamin B may not be the most eye-catching. It isn't given as much attention as D3 or B12. For older people who are suffering from energy issues, muscle fatigue, or leg heaviness, however, it may be the one factor that makes all the difference. It powers the muscles in your body. The drive has been restored. It also provides you with the strength, direction, and comfort to go through the day. If you feel worn out, weighed down, or disconnected from your body, don't disregard bone. Sometimes, the biggest effects come from the most basic nutrients. What is the best way to combine these 3 vitamins? Now that you know how vitamin D, vitamin B12, vitamin 3, and bone help your muscles in different ways, the next question is how to mix these nutrients to get the best results. The solution lies in timing and simplicity. First, let's talk about when to take each vitamin. The best time to take vitamin D3 is right after breakfast, especially if it includes a nutritious, high-fat meal like yogurt, eggs, or a little quantity of avocado. Why? Since D3 is fat-soluble, it needs fat to be absorbed effectively. The best time to take vitamin B12 is in the early afternoon or around noon. Taking B12 too late can disrupt sleep because it also increases awareness. Avoid taking it with coffee or tea. These drinks might make absorption more difficult. Vitamin B is your morning energy boost. Eat it with your first meal of the day. Ideally a nutritious breakfast that contains some protein and complete grains. It will boost your energy levels throughout the day and possibly improve your ability to concentrate. This is a simple, everyday example. 1 boiled egg, 1 vitamin D3 pill, 1 vitamin bone tablet, and a small dish of Greek yogurt for breakfast. Steamed veggies, grilled salmon or tofu, and 1 vitamin B12 tablet or lozenge make up lunch. Your body gets the correct nutrients in the right amounts at the right times. When it is set up this way, consider consuming a multivitamin. If you presently take a multivitamin, carefully study the label because many senior versions underdose these vital components. Verify that it has the appropriate amounts of bone D3 and B12. Additionally, keep in mind that certain multivitamins contain both fat-soluble and water-soluble vitamins. Consequently, it is still advised to take them with food either in the morning or at lunch, and never without food. Lastly, having more isn't always preferable. Always get advice from your doctor or pharmacist and take medications exactly as directed, especially if you are taking medication or have a chronic ailment. These 3 vitamins work like a well-oiled engine to restore the strength, balance, and energy to your legs and your life when taken as prescribed. Safety tips and warnings for vitamin use. Vitamins can help restore health and vigor just like any other tool, but they must be used with caution. When you visit the pharmacy, especially if you are over 60, keep in mind these important safety measures. First, don't increase the dosage on your own. Just because something is natural doesn't mean that more is always better. Taking twice or 3 times the recommended dosage will not result in faster outcomes. Indeed, it might even be detrimental. Vitamin D3, for example, dissolves in fat. Your calcium levels may eventually become excessively high. If you take 4 IU or more per day without supervision, this can lead to nausea, constipation, kidney stones, or even confusion. Second, exercise caution if you have liver or kidney problems. These organs are responsible for the breakdown and removal of excess vitamins from your body. If they're not working correctly, even typical amounts can build up and cause negative effects. Therefore, if you have been diagnosed with fatty liver, chronic renal illness, or any other significant condition, speak with your doctor before starting any supplements, especially fat-soluble ones like D3. Third, some of the negative effects of vitamins are easy to ignore. For instance, consuming high doses of vitamin B6 for months at a time may cause your hands and feet to become tingly or numb. Unmonitored abuse is especially prone to develop it long before more significant problems appear, even though it is rare. An excess of vitamin D3 can cause headaches, muscle cramps, and decreased appetite. Always be on the lookout for minor mood swings, especially if they occur after taking a new vitamin. Finally, have your blood levels checked. If you are taking D3 or B12 for an extended period of time, it is a good idea to do a simple blood test every 6 to 12 months. This helps ensure that you're taking the right amount of vitamins and that you're not accidentally taking too many or too little. To sum up, taking vitamins can definitely improve your quality of life, but the key is to be informed, prudent, and careful, especially as we get older. When taken as prescribed, these 3 simple nutrients can transform your strength, mobility, and independence. Let's take a moment to review. Age isn't the problem. You're not imagining it. More importantly, if your legs have been feeling weak, heavy, or unstable, it's not irreversible. Vitamin B12 has recently been shown to enhance nerve function and balance. Vitamin B12 restores your vitality and endurance, while vitamin D3 strengthens your bones and muscles. Together, these 3 essential vitamins form a powerful trio that can help you restore your strength, self-assurance, and mobility. But here's the trick. You have to start, whether that means checking your blood levels, taking a supplement in the morning, or speaking with your physician. Action is always better than waiting. I would be delighted to hear from you right away. Have you used any of these vitamins before? Has your overall level of strength, energy, or balance changed? The more we learn from each other, the stronger we become together. Therefore, kindly share your story in the space provided for comments. Thank you for watching. One strong stride at a time, take care of your body, nourish your legs, and keep moving forward.